people might think using hospice care means they're giving up. Here to talk about what hospice care really is and how it can help with the quality of life is Medi Home Health and Hospice Regional Administrator Nichole Coulard, Director of Ancillary Services Marq Gunn, and Home Care Specialist Mary Van Ostrand. Welcome to the show.
Thank you.
What is hospice care?
If it's okay, I'll answer that question. Hospice care it's a program. It's also a benefit. It's a Medicare benefit, and a lot of other commercial insurances cover it, in different ways. But hospice is really a benefit for patients who have a advanced stage illness. A lot of times people think that's terminal and they're at the end of life, but we have patients on hospice for sometimes a year or more. And it's really when they are facing a very advanced stage illness, but they're no longer seeking treatment or the test or the hospitalizations. And they find all those things that are really disrupting their life and their quality of life. So they're looking at options and things that they want to explore. How can I live my life the way I want to live it? And so we start talking to families, and we're talking to patients and their physicians, and this is a wonderful option for them to be able to live at home with dignity, with their families, with their familiar surroundings, doing the things that they enjoy, and that gives their life quality.
So you've mentioned already some of the benefits. Are there any other benefits for someone seeking out hospice treatment for themselves or their loved ones?
There's a lot of benefits to it. Hospice is not just about the clinical aspects. A lot of times our patients come to us because they're suffering, and suffering can be different than pain. So of course the priority will always be pain management if they're having anything like that that is jeopardizing their quality of life. But the other part of suffering when someone is, and it's not the end of their life, but when they've been struggling with an illness or disease, is emotional suffering, and there's spiritual suffering. And it's not just the patient that's feeling that. It's the family, it's their loved ones, it's their dearest friends. So when hospice comes on board, it's a whole team of professionals, compassionate, very caring people that's embracing that family and embracing the patient. So we're able to really offer them a higher quality of life where they get to laugh again. Their whole life isn't surrounded by when's the next appointment, when's the next test we're going to have. It's, where are we going to dinner tonight?
So it's about quality of life.
Absolutely. It's about enjoying life.
Now, what does it take to be a hospice care worker?
Well, there's quite a bit of people on the team. Mary was talking about different aspects, and we have nursing that comes in. We take care of symptom management, supporting any disease that you've been fighting for a while. We support all aspects, and we have CNAs that come in, and they take care of your daily living. So if you need personal care or that support, getting to and from the bathroom, things like that, we can come in. And you need those credentials, and there's many more people to the team that Marq will be able to talk about later, but it really just takes somebody with a heart and a passion to take care of someone in really a critical place in their life. It's really an honor, and we equate it to the very beginning of life. Very few people are able to come in and be a part of a birth. Well, very, very few are able to come at the very end. And so when we're given that opportunity and that trust, we go in, and truly what I would want the most in a hospice worker would be someone who has heart and compassion, that will follow a family, the patient, friends, all the way to the very end and be there. And that's a lot of times, it's just going to take a lot of heart and compassion.
So there is like a lot of things that are involved in hospice care. Can you talk a little bit about that, Marq?
Yes, of course. And quite often when you think of hospice, your mind goes directly to medical support, medication, symptom management. And it's very important that we also recognize and highlight the psychosocial and just looking at the picture holistically. And with that, in mind, you have social workers, you have chaplains, you have volunteer coordinators and bereavement coordinators that can assist along the way. You have your social workers that can assist with resource allocation, emotional support in the home. You have chaplains that can provide spiritual care and spiritual guidance and support. You also have our bereavement coordinators that can assist, pre, and post. So you have that support ongoing well after your loved one, has taken that final journey. And then also with that in mind, with being a caregiver for your loved one, there's a lot of times you have to pull on friends, family in the community, to help. So we have volunteer coordinators that can, provide some of that supplemental support, for social companionship. And we also, extend the invite to anyone, in our community that is interested in volunteering with, a hospice agency. We welcome those folks, whether they have personal experience or just have a heart for, folks who are on care with us.
Special people. I can only say it takes special people to do that. Now, who is eligible for hospice?
Who's eligible would be anybody who's faced that advanced stage of their illness. So, a lot of times people think it's cancer and it's the very last few days, and that's definitely a myth. Anybody who qualifies now that their illness is so advanced that there are no curative treatments at this point, and that doesn't mean you only have 3 days a week, a month. That means, you know what, I'm moving forward and I'm not going to have these treatments. Either I'm not a candidate for it or I'm choosing not to do these things. And so, a lot of times people think, well, it's not time yet. They're not in their bed. They're not this. And that's such a myth, because we should be able to come in early. The longer you have this team, the more we get to know the patient, the more we get to know the family. Trust is being built. That way, when the time does come where people think of hospice, in the bed dying, we're already part of your family. So many times people call us in at the very end, and that's just so late. So, when someone is telling you, hey, you're CHF, you're not going to be able to, or these medications are not going to make a change anymore. You're not going to see this as effective anymore. You're going to have increased hospital visits. Things like that, where we could actually come in and support and stop all those hospital visits, because we can do so many things in the home. So it's definitely a conversation with your physician. Any one of us can do a consult without a physician's order if someone's really looking at, wow, if anybody's watching and going, wow, those things are happening to my loved one, maybe I should reach out. We absolutely can give information without having an order. And of course, we can assist you all, or assist the community in finding out, is this person really ready?
Yeah, and I think you're right. I mean, I've always sort of thought that it was something that you may seek once there's only a very short time estimated to be left. But it sounds like there's a lot of services that are available that people could be taking advantage of and that would help them. In regard to cost, what is the cost, and does insurance cover it, or how does that work?
Medicare covers hospice at 100%. So a lot of times when I'm talking to families or patients, and they maybe are, advanced stage dementia or, cardiac or lung disease, there's just a gamut of these diagnoses that would make them eligible towards the end when they're no longer seeking treatment. When we're talking to them, a lot of times they are Medicare. So I tell them right off the bat, your Medicare covers this at 100%. It's not free. You've already worked for it. You've already earned these benefits. And then there's a lot of commercial insurances. Of course, we take care of a lot of cancer patients. So a lot of these commercial insurances either cover at 100%, or they've already met their deductible or whatever. We always verify their benefits up front, and then we let them know if there's a responsibility for it. We have financial agreements if patients want to sign something like that. Nichole can talk a little bit. We also have a charity program for patients that would qualify for that. So we don't ever want someone not to have the benefit of hospice because they're worried about the payment. Because, usually there's
the last thing
way.
you should be worrying about.
There's a way to make it happen.
Well, I will say, I wish we had more time, because this is such a good topic to talk about, because there is so much that can improve the quality of life in those final moments.
Absolutely.
So if somebody wanted to find out more, is there a website and we can send folks to? Or
Yes. As it stands, we're available on Facebook, utilizing Medi Home Health and Hospice. With the new year in effect, we have took it upon ourselves to revamp our entire website. So we'll have ways for the community to not only access our agency, but access us specifically here in Chesapeake. We also, for folks who may not reside in this particular region, we have offices in Chesapeake, Newport News, and also a sister office in Elizabeth City, North Carolina.
Great. Well, thank you so much for talking about this. this subject today. Really
I
appreciate
would.
it.
Thank you.
Awesome. Thank you so much.
I really appreciate it too. And they can always call the office and ask for one of the home
Okay.
care specialists for a personal consultation. We're happy to do
All
that.
right. Wonderful. Thank you.
Thank you.
We have to take a quick break, but up next, find out how you can learn how to buy a house, paint a picture, and take photos, all from your local library. Stay with us.